I first was aware of varicose vein issue when I was referred to a dermatologist for actually skin, and she said, "You really should wear compression stockings."
60-year-old Thomas Burke suffers from varicose veins. He followed his dermatologist's advice and wore compression stockings for several years. He says they helped until he noticed a change almost a year ago.
After I retired, I was walking a whole lot more, and I was getting some pain and some burning in the area of the varicose veins.
Varicose veins are bulging veins, usually in the thigh and calf area, that can cause a significant amount of pain. They're caused when valves in the veins that prevent blood from flowing in the wrong direction stop working properly and cause blood to pool and your veins to bulge. Dr. Alan Hamdan, a vascular surgeon at the Cardiovascular Institute at Beth Israel Deaconess Medical Center, says while compression stockings do help, they are not a cure.
And that's just putting a Band-Aid on a wound. I mean, it doesn't make the condition go away, but it helps with the symptoms.
That's why Burke opted for a new minimally invasive approach called the closure procedure. Not only does it alleviate symptoms, it also makes varicose veins disappear.
The way some people have described it is it's like closing a Ziploc bag. So you're taking the vein, which has blood flow, but basically blood flow in the wrong direction, and putting the two walls of the vein together from the top to the bottom. And then this is what remains of the saphenous vein, which is what we're trying to treat.
The procedure works by inserting a catheter into the vein using ultrasound guidance. Anesthesia is injected to compress the vein, and heated radio frequency energy is used to close it. The vein then gets reabsorbed by the surrounding tissue.
I've been very happy with it. The pain of the procedure was just merely like getting a needle. For the anesthetic was about the only pain that I recall in the procedure.
Dr. Hamdan says while there is certainly a cosmetic benefit to this procedure, it is done to treat symptoms.
Everyone who has varicose veins doesn't need this procedure, but if they're having bulging veins in the leg with pain, discomfort, heaviness, inability to stand, those are the sort of the characteristic symptoms where they can be evaluated and go over the options and consider having a treatment done.